Are you considering semaglutide for weight loss? Hold on, there are some reasons to stay clear of semaglutide. Let's talk about these things. I'm Dr. Kane, the Drop Weight MD. So when we talk about who should or shouldn't take semaglutide, there's a list of specific health conditions and contraindications that we go through with patients to determine if they should or shouldn't start with semaglutide. So let's discuss these reasons. The first four reasons are absolute contraindications to taking semaglutide, where we just wouldn't even start you if you have any of these things. One would be a personal history of thyroid cancer. When we talk about thyroid cancer, does that mean that semaglutide is going to cause thyroid cancer for you? No, but studies have shown that rats have an increased rate of thyroid cancer when on semaglutide. Even though humans does not equal rats, that's still a reason we just avoid semaglutide in patients who have a history of medullary thyroid cancer. What about a family history of thyroid cancer? That doesn't necessarily exclude you from using semaglutide, but there is something called medullary neoplasia syndrome, that if your family has a history of medullary neoplasia syndrome, we don't start you on semaglutide either. And if you haven't heard that term, then most likely your family does not have a history of medullary neoplasia syndrome. Another reason we don't start someone on semaglutide is if they are either pregnant, breastfeeding, or trying to get pregnant, because there can always be an accidental pregnancy that someone's not aware of, and they might be on semaglutide and just might not know that they're pregnant. And the reason why is because semaglutide has not been tested enough in pregnant women to know if it has an adverse effect on the fetus, or hasn't been tested enough in breastfeeding women to know if it has an adverse effect on a baby. No one wants to test out these things. So I don't think we'll ever know, because again, no one's going to test out on a pregnant woman or fetus regarding these effects. So the advice is always just avoid it if you're trying to get pregnant or breastfeeding. Hey, has Ozempic or semaglutide stopped working the way you want? Or are you ready to get started but want to ensure you are effective? I totally get that. I'm Dr. Kane Lai, and I've helped thousands of men and women lose weight in the last 13 years. My program, Drop Weight MD, is designed to help you effectively lose weight with semaglutide. I'd like to chat with you about it. To schedule a free consultation, click the link in the description or go to dropweightmd.com. Now, there are other conditions that may cause a little pause or a little caution in us when we talk about using semaglutide in these individuals. One is if you have vision problems. So if you have blurry vision or have a particular history of eye issues. Because semaglutide has been found to possibly worsen diabetic retinopathy. So diabetic retinopathy is a blurriness and degradation of eye quality when patients have diabetes. And this has been found to possibly worsen in diabetics because Ozempic, Wegovy, semaglutide are most commonly used in diabetics in the first place. So that's been a finding that causes concern. And so you always want to discuss that issue with a healthcare individual if you have a history of eye issues. Another thing that can cause pause is if an individual has a history of kidney disease. So semaglutide may worsen clearance of the medication from the body. And what that means is your kidney processes a lot of different things. It's the filter for the body that eliminates waste through urine. So certain drugs are cleared by the kidney, certain drugs are cleared by the liver. So there's just a different process by which certain drugs are cleared from the body. And semaglutide's route is through the kidney. And so if you have kidney disease, that can impact how much circulating semaglutide levels you have, and also may impact the kidney's function. I also use caution in patients who have a history of gallbladder disease. So having gallstones or a history of pancreatitis, which is inflammation of the pancreas, those are also things that can worsen with semaglutide. So the other day when I had a patient talk about, oh, I had pancreatitis 15 years ago. And when we dug into it a little bit more, it was just a short bout of pancreatitis. He wasn't even sure if it was pancreatitis, but it was so short and so remote that I wasn't overly concerned about starting that patient on semaglutide. Whereas I had another patient who had a history of gallstones, but when we dug into that, these gallstones just keep coming back and back for that patient. They hadn't ever had surgery for gallstones to remove the gallbladder. So we decided not to start semaglutide and started instead with a regimen of nutritional modification and exercise. So that's another thing to always assess, is the degree to which these things are a concern for the patient. And the last thing that we worry about with the patient is if you have experienced a lot of GI issues in the past. So there are some patients with Crohn's disease, ulcerative colitis, gastric reflux, where we want to dig into how severe these issues are, because since nausea, constipation, and diarrhea are common issues with semaglutide, how likely is this to impact your life? Last thing is, have you had a previous allergic reaction to semaglutide? So this may seem obvious, as in if you respond with shortness of breath, swelling, or a different allergic reaction to semaglutide, then you should avoid semaglutide. But some patients have the idea in their head that even if they were allergic to something in the past, maybe it's something that has changed and they outgrew, or with time, let's try it again to see if that occurs again. And most likely it's going to occur again. So you don't want to take those risks if you've had a previous allergic reaction to semaglutide. We don't want to induce anaphylactic shock or anything like that in a patient with that prior history. So those are the various reasons why we exclude people, or why you can't take semaglutide as a patient. If you like this topic and want to learn more about taking semaglutide, see us at dropweightmd.com or subscribe and like our channel. Thanks very much. I'm Dr. Kane, the Dropweight MD.